and legs. Quadriplegia is paralysis of all four extremities, both arms and both legs, whereas hemiplegia is paralysis of one side of the body. Could be either the left arm and leg that are paralyzed or the right arm and leg. Of all of the topics that will be discussed in this training program, this topic about complications of immobility, it ranks near the top of the list for importance. Whether a patient develops these problems has a lot to do with how serious we take the responsibility we have to prevent them. I will be reviewing the various problems as they occur by individual system. The first system that we'll be talking about is the system of the skin, or integumentary system. The skin serves as a protective function to the body. It helps keep microorganisms out and fluid in. Bed sores are by far the most common result of immobility. Bed sores are also called decubitus ulcers or pressure sores. There are four main causes of bed sores. The first is that pressure on the skin and bony parts of a skeleton can occur from lying too long in the same position in a bed or chair. The second main cause of a bed sore has to do with shearing force. Shearing force results from underlying layers of skin sliding against each other, much like I'm doing with my hands. This sliding against each other happens as patients slide down in the bed. The shearing causes blood vessels to break underneath the skin and damages the underlying layers of skin. A third cause of bed sores is friction. It happens when patients slide or rub against the linens. An example might be if a patient wants to scoot themselves up in bed, they will frequently dig in with their elbows and their heels in order to get higher up into the bed. The elbows and heels become reddened and painful and damaged and can result in breakdown of the skin if this continues. Moisture is another main cause of bed sores. Patients that are incontinent of urine and fecal material or stool tend to get bed sores because the moisture and caustic substances in the urine and stool cause the skin to macerate, which leads to breakdown of the skin. By now, I think you can pretty well guess those folks that are most at risk for the development of bed sores. Nurses use what are called either the Norton or Braden scale for the prediction of pressure sore risks. Some of these risks of patients are those that are immobile, elderly people who are frail particularly and have dry skin, thin patients who have only a little fat layer to cushion the skin, obese people because of the excess weight bearing down on the pressure points of their bodies, poorly nutritioned patients, those that are incontinent of urine and or stool, those that are unable to feel pain or pressure. A diabetic comes to mind. It's not at all uncommon that diabetic patients have loss of sensation, a numbness, in particular the legs and feet. If a person has shoes on that are too tight, bed sores can develop because they don't have the sensation to feel the pain experienced by the formation of the bed sore. Lastly, devices. Casts or traction can cause friction, pressure, and rubbing against the edges of the devices, and that makes them much more at risk for the development of a bed sore. What can you do to prevent bed sores from forming? The first and most important thing, of course, is to move your patients. Reposition them at least every 1 to 2 hours. Use pillows or wedges to keep bony parts from direct contact with each other. Use heel and elbow protectors to prevent the friction burns from occurring. Use a trapeze or other lifting device, such as a draw sheet, rather than using heels and elbows to be raised up in the bed. Monitor the bed elevation. Beds that are elevated at a right angle, 90 degrees, put an awful lot of added pressure on the patient's buttocks and should not be in that position for prolonged periods of time. High fowlers or bed in a 90-degree position should be reserved primarily for times when patients are eating. Use specialty mattresses or seat cushions that help reduce the pressure by distributing the body's weight. And lastly, keep skin clean and lubricated with a moisturizer. The musculoskeletal system is another system that is impacted by immobility. It's often easy to see complications that occur with this system. Muscles become smaller, the person becomes weaker and has less endurance. I'm sure you might have experienced being in bed for a day or two due to a bad cold or flu. Know how that feels the first time you get out of bed after a prolonged bed rest? Your joints might be more achy, you're a little bit lightheaded, you feel weaker than ordinarily. It doesn't take long for some of these complications to occur. Wasting away of the muscle can occur. This wasting away is called atrophy of the muscles. Brittle bones develop. Loss of calcium from the bones is called osteoporosis. This osteoporosis causes holes to be in the bone itself, much like a piece of Swiss cheese. Calcium loss begins as early as 2 to 3 days after the onset of immobility. This loss of calcium leaves bones much more likely to break. Another complication is stiff, achy joints, as we mentioned a little bit previously. Contractures can also occur. Contractures result from joints that have been allowed to remain in the same position for too long. The muscles stiffen and shorten, preventing the joint from full movement. The joint becomes fixed in a bent position. Contractures are permanent and can interfere a great deal with mobility and the person's independence in activities of daily living. Foot drop can also occur. In foot drop, the muscle in the calf of the leg tends to tighten, causing the toes to point downward. This causes foot extension and prevents bending or flexing of the foot. Even a brief length of time in bed is sufficient to cause a degree of foot drop that makes walking or application of shoes